Every time your foot strikes the ground, your entire body weight is channeled through the inner edge of your foot. If you have a bunion, you're feeling the mechanical failure of that process. Because this is a physical shift in the skeleton, no external pad or splint can pull the joint back into place. Only surgery can achieve a permanent structural realignment. This protrusion on the side of the foot is not a thick callus or a layer of extra bone that sprouted over time. It is a structural dislocation of the first ray. The first metatarsal bone has moved inward, toward your other foot, pushing the joint out of its original track. This X-ray shows the physical result of that shift. Clinicians measure this using the Hallux abductus angle. Once that measurement passes 20 degrees, the joint is considered a clinical deformity. When the bump on your foot is actually an entire bone pushed out of alignment, surface-level treatments like creams or pads cannot make it disappear. The first metatarsal lacks stabilizing muscles. External pressure from genetics or narrow shoes forces the bone inward. This seesaw effect pulls the big toe outward, widening the angle. Eventually, inner stabilizing tissues stretch and rupture, leaving the joint unsupported. Since this is a progressive mechanical failure, non-surgical treatments should be judged only on their ability to manage the pain, not their ability to fix the bone. To decide on a treatment, plot options on this quadrant. We weigh effort and cost against how much the treatment changes the deformity. First-line management is footwear modification, switching to low-heeled shoes with a wide toe box or using a shoe stretcher. Removing friction from the bony prominence stops the cycle of bursitis inflammation and lowers daily pain. The trade-off is clear. You lose the ability to wear narrow, fashionable shoes, but the bony deformity remains exactly as it was. Further right on the effort scale are orthotics and night traction splints. They cost more and require daily use, but they still only offer symptom relief. Orthotics improve how your foot moves during a stride, while splints stretch tight tissues. This is very successful at slowing the progression of the deformity. While these tools make a bunion livable, they cannot push a dislocated bone back into its original position. If your goal is true structural realignment, you have to move into surgical intervention. Most surgeries involve a procedure called an osteotomy. This means physically cutting the metatarsal bone and manually resetting its alignment. Once the bone is reset, internal hardware like screws or plates is often installed to hold the new position. Recovery is a major commitment. You may face weeks of strict non-weight-bearing mobility, where you cannot put any pressure on that foot. It takes 6 to 8 weeks for the cut bone to achieve a full union and fuse back together. Post-operative pain and tissue swelling can persist for several additional months as the foot heals. The benefit is definitive relief for patients with severe, chronic pain that previously made walking impossible. You should not expect the toe to be perfectly straight after it heals. A successful surgery still leaves a 10 to 25-degree angle at the joint. That is the standard medical outcome. Even after surgery, you still may not be able to fit your foot into narrow, pointed shoes without discomfort. Failing to understand these physical limits is the primary reason patients end up dissatisfied with their surgical results. The math of surgery, the months of recovery, and the internal hardware only balances out if the goal is functional pain relief. If you are looking for cosmetic perfection, the recovery cost often outweighs the result. Avoid the targeted ads for gadgets that promise to magically straighten a skeletal deformity. They cannot reverse a structural shift. Instead, follow this clinical decision flowchart. Your path is determined strictly by the severity of your symptoms. If your goal is to walk without pain and stop the deformity from worsening, you belong on the conservative path. Guidelines suggest 3 to 6 months of using wide toe box shoes and orthotics before even considering more invasive options. The surgical path is for patients with daily pain that disrupts their gait and balance, and who have seen no improvement after that 6-month conservative trial. Only these refractory, high-pain cases should seek a referral for surgery. Never undergo an osteotomy for strictly cosmetic reasons or to fit back into high heels. A bunion forces a choice. You must either adapt your lifestyle and footwear to accommodate your foot, or endure the trauma of surgery to adapt your foot back to your life.